Hi, this is Dr. Eric Westman doing another edition of Ask Adapt. I'm here in Mallorca at Low Carb Universe, put on by Hannah and Sebastian Botheus, second year in a row. Today's Ask Adapt edition is about, are you losing body fat as fast as you should be? That's an interesting question. I mean, assuming you're doing the keto program, LCHF adapt program to lose weight, no one really knows how fast you should be losing body fat. There are a lot of guidelines, how fast, not too slow, because then you get frustrated and you stop doing it. The rule of thumb is 1 to 2 pounds of weight per week, and that includes some water weight and fat weight, is the healthiest rate of weight loss. There are a lot of ways to lose weight, including surgical and medical ways to do it, but why not do it just by changing the food? And that's what we see with a low carb keto program for weight loss. It's about 1 pound or 2 of weight loss per week. So I'd say that's the optimal rate of loss. Now you have to be sure that you're getting adequate protein. And the next question is from Monique: how do I know I'm losing body fat and not protein or muscle mass? Well, the studies have been done, now they've been done for 15 years or so, showing that if you have adequate protein, sufficient protein in the diet, you won't lose muscle mass off your body. So most of my patients don't directly measure their body fat or muscle mass. They just know from the research, and I know from the research that has been done, if they eat a certain particular way with sufficient protein, then they won't use their muscle mass or lose their body mass from protein. You don't want to lose protein from your body. Debb asks, I've been doing keto for 18 months. I've been consistently losing body fat, but it seems to be burning less as time goes on. Now, Debb, I'm not sure if you're talking about fat loss on the scale by a bioimpedance machine or if you mean ketone levels. There's this big confusion now that you can measure ketones in the blood, breath, and urine, and that is representing fat burning. Well, it is, but it's not representing fat loss off your body. So you might have a ketone level that goes up and down, maybe fluctuating, maybe doesn't even meet the criteria of ketosis, nutritional ketosis. I don't worry so much about that level. As long as the weight is coming down, your hunger is gone, you're feeling well, don't use the ketone level as the guide of how much fat you're losing. Now, it may be that your weight loss is slowing down over time, and that's what we typically see, except for those who, for some reason, adjust their food intake automatically with the change in their weight, and that happens for some people. For some people, the social eating when they're not hungry, eating because it's time to eat, eating out of the growling stomach sort of thing, that is one reason why it might slow down over time. We expect it to slow down a little bit. Tony asks, what's the expected fat loss per month? And that's 1 to 2 pounds per week, 4 to 8 pounds per month, or 50 to 100 pounds per year without pills, products, surgery. That's actually pretty incredible. Josh asks, I've been keto for 8 months. I've lost so much weight, I'm worried that I might lose too much. Is this possible? Well, not if you're listening to your body signals of hunger. And if you think about it, there are animals that don't eat very often and they don't whittle away to nothing, like wolves and lions and that sort of thing. When you're losing weight, you follow your body signals, and then what will happen is your weight will settle out at what your body thinks is normal, not necessarily your brain. And so we do a lot of teaching and about expectations and what is a healthy weight over time, and it's very individualized. So what you want to do is, I think, connect with somebody who kind of knows what the expectation is. An obesity medicine specialist or a keto specialist would be a great resource. Molly asks, why does it seem that men lose more weight and faster than women? Well, it's partially true. If you matched age, gender, and activity levels, men do lose a little faster, but it doesn't mean that women don't. And the hormonal fluctuations that women go through with menstrual cycles and with menopause do make it more difficult. And I really work hard to have people not compare themselves to their spouse or their friends who might be losing faster. Of course, the more active you are and the less you eat in general, the faster the weight loss will be. So if you're trying to improve or speed up your weight loss and you're eating healthy foods, I'm finding that intermittent fasting or time-delimited eating is just a construct for people to understand that they don't have to eat 3 meals a day. If you're not hungry, you don't have to have breakfast, that sort of thing. And that will speed up the weight loss, but you don't want to have more than 1 pound or 2 per week unless you're under medical supervision. Under medical supervision, we can see faster and greater weight loss, but we worry or we check certain electrolytes, certain blood tests to make sure that it's particularly safe. Are you losing body fat as fast as you should be? Hope that's helpful. Until the next time.